Wow, 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 wow. Thank you so much. Thank you so much. Thank you so much, Nostomi. Thank you so much. Yeah, just like training is inevitable because in the world of care, in the world of health, things keep changing at every point, at every year. Resource Council in advanced nation, even in our third country, things keep changing with time. Now, my next question is, as we get, you mentioned WHO, that's the World Health Organization. Where would you place Nigeria at the moment as regards the resources, the technical know-how? Where should we be placed, and what should maybe if government parastatals, the government of the day is listening to this, what constructive thing we can put in place to be at that stage where WHO requires every healthcare to be?
Okay, so there are lots of difficulties that nurses are facing in developing countries, especially from Nigeria. I practice in Nigeria, so I'm talking from experiential knowledge, really. So the patient to nurse ratio in Nigeria and some other developing countries are quite high, meaning that you're not able to give that holistic nursing care to patients because you have the patient to nursing ratio is quite high. Ideally, the WHO and the standard ratio of nursing to patients is not what we are seeing in developing countries, and there's no way that bias of care or patients will not be having low quality of care when nurses are not able to meet up with that population. Also, the infrastructures as well and standard, they are outdated, so a lot of nurses are working in an environment that the buildings are dilapidating, really they're not up to standard, the equipment they are using to work is not up to standard as well. Also, we cannot rule out the factor of the low income that is being given to nurses in developing countries, and as we know, if a nurse is not mentally stable, it's going to affect his ability to care effectively for their patients. So basically, in terms of infrastructure, in terms of the population ratio, in terms of the electricity, the sanitation, the environment, the equipment that the nurses are working with in developing nations is way, way, way far behind compared to the developed countries. And this contributes to the kind of the quality of care that nurses are able to give to their patients in developing nations.
Wow, wow, wow. Excellent, excellent. Yeah, I work in the training section of NHS where we do basic life support, fire, moving and handling, and all sorts. And back there in Africa, I'm not sure we have such. My question is, how does training enhance developing nation progress as regards health-wise?